Obviously, serology is something that we're looking forward to because it does help us understand retrospectively what's been happening in our communities. And there's a lot of work being done on that. The BC CDC is working with our National Microbiology Lab even as we speak. And so I do expect that we will have a serology test that we'll be able to use very soon, within the next few weeks. And it is one of the measures that that is helpful to us in trying to understand what are the things that work, how can we monitor this through time. But it's not the only thing, so it is one of the things that will help us. And we've been putting the building blocks in place for helping us use a serology test when we get one that is reliable and has been validated. And so I do think that will be coming quite soon. In terms of the report out of Korea, yeah, I think in the scientific discussion of that, it's really unclear. It's unclear whether it is people starting to shed the virus again, which can happen with, we know, with other viral infections, whether they are able to pass it on, so whether it's live virus that they can pass on to others, still not clear. It does not appear to be. Whether it's a reactivation or whether it's a test issue, because some of the tests that we have can be falsely positive or falsely negative, or it may be picking up just more shedding of a virus that's no longer live. So it is the genetic material from the virus. And there's an ongoing discussion about that. It does not appear that that is driving an increase in infections in the community, but obviously we're watching that carefully to try and better understand what it means in the grand scheme of things. The testing strategy is for people who are sick in the community. So yes, we're going back to similar to where we were several weeks ago, where we can focus more broadly on people in our community who are getting sick to try and pick up clusters again. As you know, the people returning travelers are what we focused on also early on, and there's much reduced traffic returning, but that is also a place that we'll be focusing. And essential workers have always been part of the strategy, but so it really is up to the clinical judgment of the physician. One of the things that we are seeing is that with influenza season really dropping off, much fewer people are showing up with the respiratory illnesses across the province, and those who have it are much more likely to be something like COVID. So early on, our positivity rates, so for every 100 people who were tested, one of them was positive for COVID-19, and about 20 of them for the last couple of weeks were positive for influenza or other viruses, but particularly influenza. We've now seen influenza basically disappear, as it tends to this time of year. So we're targeting again, trying to make sure that we're catching everybody in our community, but particularly where we see clusters or outbreaks or risk for people impacting on our healthcare system. So the testing has gone up a bit, but we're also seeing fewer people who are getting sick. So that's kind of reassuring in some ways too. In terms of the percentage of, I don't have it off the top of my head what, in terms of the deaths, what it is between men and women. The reflection of the cases who are sick with COVID-19 being a higher proportion of younger women reflects that there's a lot of healthcare workers who are in that number, many of whom had quite mild illness. But the data will be updated on the BC CDC website, and it does give you the breakdown of male and female in that. And I do recognize that around the world we're seeing a slightly increased number of men who are dying from this or hospitalized from this, and nobody's entirely sure why that is. So we have been targeting our testing. We've also been doing surveillance testing. So that is any swab that anybody in the province sends in for testing for any respiratory virus automatically is tested for COVID as well. And we also have been, as you know, targeting healthcare workers, our outbreaks, and our percentage positive has been going up, which tells us that we are finding the people that we need to find. One of the main reasons why our capacity has increased across the province, which is great. One of the main reasons why we're not seeing a lot of increased testing is because we are seeing fewer people with respiratory illness that are being sent for testing. So that is, a balancing. I expect that we'll continue to increase the amount of testing that is being done, but we know that there's fewer people coming back from other countries, and that was a large part of where illness was arising, and that there's fewer people being ill with respiratory illness, with signs and symptoms that could be related to this. We are continuing to test widely in our long-term care facility outbreaks, and with a very, very sensitive, so you don't have to, for older people, we know that they can have very mild, one wouldn't even call them symptoms sometimes. It can be just an increase in fatigue or lack of appetite, for example. So we are testing very actively in those settings and in our outbreak settings as well. But we've seen a decrease in healthcare workers, for example, who are becoming ill. So that's it's partly a good thing, and it's partly a reflection of the amount of respiratory illness that's in our community right now.